Well, I graduated with a degree in nursing in 1961, and then I spent 33 years in nursing and nursing education. And then I worked for research for a while, but not directly in nursing. It was in the healthcare field. Yes, I enjoyed my years in nursing very much. I really liked the people, I liked the patients, I liked working with students, which is what I did in nursing education. I liked working with the hospitals and the agencies I worked with. Yes, I enjoyed it very much. What did I dislike? I disliked some of the government budget cuts. In those days, that meant we were not able to take as many students. We weren't able to do as good a job because we had less staff. Well, because I did my degree in nursing, I attended 5 years of post-secondary school. But also because I came out of rural Saskatchewan, I didn't have the prerequisites. So I was required to go to intersession and summer school to pick up physics and some other courses like that in order to be admitted as a student into the second year of the program. Well, I did spend you would call what I did nursing, but working as a general duty nurse and caring for patients was a small part of what I did in my nursing career. Because I graduated, I worked as an RN on surgery and then psychiatry. I cared for patients, and then I went into nursing education and was with the College of Nursing. Then I went with SciAst, and so my career really was all focused on nursing. But some people would talk about nursing as being the direct care with patients. And no, I didn't spend a lot of my career doing that. I worked directly with patients, with students, and certainly overseeing student careers and student education. Well, when I was doing direct patient care, an average day of nursing was 8 hours a day, 40 hours a week. So it was a different schedule than they do in today's society. When I worked with nursing education, we worked what you called undefined hours. So we worked with students, we worked with staff, we worked with hospitals, and really working undefined hours really meant you worked perhaps as long as the need was there. Some days were shorter, maybe 5 hours, other days were 12 hours. It varied a lot in order to meet the requirements of the job. Well, the difficulties of being a nurse for me were that I had children, I had a family, and that made it difficult to find caregivers for children. It was difficult to work the shift work, evenings, nights in particular were difficult. The difficulties really rotated more around my family responsibilities than the actual nursing of patients or nursing education. Well, that's a very difficult question. What areas of nursing needed improving? There were many areas that I felt needed improving. One was the attitude of nurses towards other nurses. There used to be a saying in nursing, only nursing eats its young. And I would find that very often the old established nurses were not very kind, not very caring, certainly not very educational towards new nurses in the field. The other areas that I felt needed improving were the attitudes of the relationships between nurses as a very important provider of care and other people in the healthcare field, the doctors, physiotherapists, pharmacists. It seemed that nursing was held accountable, was there 24 hours a day, expected to pick up physio, pharmacy, many things in medical areas when those people were not available. Nursing was kind of at the bottom of the rung, and I felt that attitude-wise we needed to become a very professional group on an equal level with other professionals in the field. That was my big dream and big hope that nursing would one day be recognized as an independent profession with skills and knowledge that were carefully defined by nurses and useful in the healthcare field. Well, the areas have changed a great deal, and in many ways nursing has become an independent profession recognized in the healthcare field, a profession which has skills which pertain specifically to nursing. And I believe this has come about because of the baccalaureate to nursing. So we were educating our nurses today in a much more holistic manner with stronger critical thinking skills, many good skills in the clinical area, many good assessment skills. And so I think that nursing has changed a great deal, has become a profession with interacting with many other professions. And I believe it has to do with the higher educational standards and the excellent, really excellent education of nurses to meet today's needs for health care. So far, that's one of the most difficult questions. Are there problems in nursing now? Yes, I would say there are problems in nursing now that we never faced as in my career. We used to say the definition of nursing is placing the patient in the best possible conditions so that nature can act upon him or her. In today's world, the problems for nursing have more to do with technology, with expectations of the public that nursing and medical interventions are going to make their loved one well, when in actual fact it may not be at all possible. And so yes, there are many problems faced by nursing today that we never dreamt of. The medications, the technology, the skills, the knowledge, everything in today's world is much more intricate, shall I say. It's much more comprehensive. Much more knowledge is needed to understand, to assess, to treat, to care for people. And so, yes, there are many things in the world today or in nursing today that we didn't quite dream of. For example, one of the areas that's being explored and will be used is in the area of robots. Robots that will take vital signs of patients. Robots that will be used to teach. Robots that are used to do surgical interventions. The whole area of robots, the whole area of technology. Oh, technology has just exploded and become a whole field unto itself. Technology has changed the world of assessing, of giving care, of communicating, of recording. Everything about nursing relies upon technology and the use of technology. When you ask how has it changed nursing, it hasn't changed the fundamental caring aspect of nursing. It hasn't changed how we talk to patients, how we care for patients, how we interact. But it certainly has changed the assessing and the actual direct care, direct interventions to help that patient become well enough perhaps to go home or to live on his or her own. Oh, I think they would have been marvelous to have. They would have helped, I suppose, improve the quality of care that we gave, because we had the technologies to use to assess the patients, to record, the technologies which would have made nursing much more interesting, much more hopeful, perhaps less drudgery. For me, technologies would have opened up a whole new phase of life. We'd have become perhaps more enthused about nursing, more intuitive, and for me at least, the technologies would have been a godsend in my teaching and in my care.